Well, today we announced the Commonwealth Health Alliance, and the Commonwealth Health Alliance is designed to help us set standards and to certify basically the use of technology to exchange data and make data more liquid in our environment, so that the industry basically can build to a solution that allows us to share data across systems that may not all be coming from a single company or a single vendor. And the idea here is that we can get better utility out of the investment that's been made by many of our hospital customers in particular, and allow them to connect to non-native systems. If they bought somebody else's system and a physician has a different system, they can talk to each other. Certainly we should have been doing this years ago, so now is better than next month or next year. I also think that we've gotten to a state of implementation of technology that the interoperability question has become more and more acute. And I also think technology is evolving, so we can use things like the internet that may not have been possible 15 years ago to actually exchange data in a cloud-based way, or in a way that's easy and cheap to do. Our vision of Commonwealth Health Alliance's primary and initial function is related to patient identity, patient consent and rights, and then basically simple record locators that will allow us to identify resident in another system, whether it's a physician system or a hospital system, the data that's associated with that patient. Some HIEs have evolved to try to deal with some of those same issues, but I think that many of the HIEs are probably not as sophisticated as they need to be, and haven't been able to deal in particular with the identity issue. And we also, I think, don't want to pursue a strategy where we're warehousing patient-specific clinical data in a repository kind of a way. We think we can get at that data that resident in the systems that exist already in the marketplace. It began really through a trusting relationship with a couple of McKesson executives and a couple of Cerner executives involved heavily in the activity in Washington, D.C. And I think that the awareness of policymakers related to this problem and industry participants in that policy-making process realize that we can't wait for Washington to make this happen. We have to take the leadership role ourselves. So I think the initial drive or focus and partnership between Cerner and McKesson on this was really driven by our people that are closest to the issue, and opening the discussion to others, at least in the early phase, was meant to signify to the rest of the industry that this is a solution we hope will meet everybody's needs. So we did not want to make a Cerner-McKesson announcement and have others feel like they were left out or that they wouldn't fit. For us to be truly successful as a country, to change the cost and quality of healthcare and to make a big impact, we're going to have companies like Epic participating in this as well. And I don't think anything that we've discussed today in our strategy should be something that should be adverse to what Epic's trying to accomplish with their strategy. We have a tremendous amount of respect, not only as McKesson, but also as the Alliance, around all of our industry competitors and participants. And this is one place where we think competition should be put aside, and we should be focused on cooperation and collaboration to move this data between various systems. So I'm hopeful that they won't find it as a threat. So I think the most important thing for them to do is become educated with what we're trying to accomplish, and hopefully sessions like this will be helpful in making that happen. And the second is to, once they become comfortable with the strategy, is to encourage their IT vendors that are involved in their enterprise to open their minds to the idea and to explore participating also in the Alliance, so that we can get everybody in. I think that's the most important thing.